families families struggle with that, and I empathize with that, particularly families where the families may be ruptured families or split families, and guess what? The parents may also be dating, and then so that sort of flips the equation a little bit, and I've had kids that, God, I waited up till midnight before my mom came home, and so the tables turn, or Facebook epidemic is not restricted to teenagers, believe me, and again, sometimes the adult as well in the family will kind of maybe provide a modeling or structure that isn't ideal. So I think it's very critical to be clear about one's values and to demonstrate and communicate them clearly to your kids, for sure. Now, I started out by asking what adolescent sexuality was, and there's a guy called Michael Carrera who's a very interesting fellow. He's the head of the principal of Hunter College in New York City, and he had an idea about reducing teen pregnancy. I won't give you the whole story unless you want to. It's a lovely story, but it's a 2-day seminar, so you have time. And so he left his position at Hunter College, and he went up. He was working in Harlem, where the pregnancy rate was about 50% for teenage boys and girls. Either fathering a child or being pregnant. 50%, very, very high.
Integrated school system, Doc? I mean, was it black community or in Hispanic or New York?
In Harlem, it was black and Hispanic. Yeah. So he, anyway, so he was working in this. If you want to ask me later, I'll tell you about the program. But it's a wonderful program. But what he noticed, let me tell you the anecdote. Okay, I'll share it. You convinced me. So the anecdote is this. So there's this. They have a center. It was at the I forget, the Catholic Service Center or something like that, or the Y. I can't remember. It doesn't matter. And so Michael Carrera walks in into the center on Saturday morning, and the social worker is sort of pacing back and forth in front of the bathroom, and Carrera goes up to him and says, "Oh, what's going on?" And he said, "Johnny and Sue are in the bathroom together. I'm not sure what to do." So Michael Carrera bangs on the door, walks in, and says, "Get out!" That's what he right. And so Johnny and Sue walk out, fully dressed in winter clothes, gloves, mitts, hats. What are you doing? We're just looking for privacy, And he was making the point that amongst these kids, 50% pregnancy rate, the majority of them had never kind of held hands. The majority of them had never experienced sort of a closeness or an intimacy that wasn't sexual. It was only sort of pelvic or nothing. And so he said, there's intercourse, but there's also outer course. And when we talk about adolescent sexuality, I think we have to make sure that we keep our minds open to the broader sexuality and not just focus on what the media or the sitcoms represent to us.
Was the project successful?
It was very successful. Very successful. The other thing to think about before I say that, is it fair? I mean, I don't know if people are comfortable enough, but is it fair for me to ask you what questions you have around sexuality or around adolescent sexuality that would have brought you here? Is that fair? Or the other option is if you wanted to send me questions if you don't feel comfortable sharing them, that's fine too, because I really want to try and...
You can ask.
I am asking.
Let us know. We can turn off the video if you prefer.
Yeah.
For example, Doctor, that lady that you just spoke, the lady that you named down, but she said she sees the opposition, she sees society, the culture of the land going against her scale of values. So there's a combat situation in your family, something like that. Each one must have their own thing. But what do you advocate, Doc? What do you advocate? Do you believe in this whole thing? I mean, the STDs are on the increase. Who cares? I'm a teenager. I don't want this condom. I need to freely go whatever they talk. I don't know.
It's like making love. It's like having a shower in the rain for one. That's the expression, right? Yeah.
But on Friday morning, I heard on the radio locally, he was talking about the money that's been spent from the federal government and provincial government into protection for young people and all the different things they're providing for them. billions of dollars. And he said, even though that's happening, and they were providing all this protection, condoms and pills and needle and all the different things that they have for the young people, HIV and other diseases has escalated 50% more. What is causing it? Young people don't want the protection. They've gone to oral sex and all the other wrong things. And oral sex causes HIV and all the other different things that, to make you sick, all these germs. And for me, that was education. So what do we do? If they're allowing kids to do these sorts of stuff, to me, it's telling a teenager, here's protection, here's condom, here's this, here's the pill, here's the thing. You're saying, okay, you go and have your sex. Free shit. But now they want to go to a higher level. So they don't want those things. They do the things that they see on TV and blue movies.
Okay. Yes.
How important do you feel it is that when we're talking to our kids, you're talking to the same gender? I have 2 boys.
Yep.
They're a little more comfortable talking. I can talk to them more comfortably. How important is it truly that their dad has those conversations with them about their sexuality and where they're going? Is there...
Well, again, I think it's probably not the gender as that's the issue. I think the issue is the relationship that's evolved over since this time. I mean, sexuality doesn't start at age 12, 13, or 14, or 15, or 16. It starts then. And I think a lot of it is again, a lot of what is sexuality is really what is relationship. And I think those relationships, as they evolve, not only between parent and child, but between parent and parent, are very, very critical in terms of setting the stage. So what allows, I mean, I'm sort of empathizing or extrapolating to my own experience when I see kids in my clinic. I see girls and boys, obviously. And occasionally, the females will ask for sort of same gender issues, but that's kind of an exception. And I think the real issue is around safety. So if they're able to feel safe within the environment, within this relationship, then they're quite able to come forward. I'm going to bring up also the issue because so far we've been talking about sort of heterosexual intercourse, but sexuality goes again beyond the behavior, and it extends also to the identity. A lot of young people, as you know, are struggling with sexual orientation issues, and this is particularly true for young adolescents. The questioning begins, the self-questioning begins oftentimes in sort of 10, 11, 12, and sometimes even younger. Generally speaking, adolescents are aware of their sexual orientation by around 14. And yet, although it's more available now, there's more room for them, for kids who are experiencing sexual diversity, to express themselves currently. That's relatively recent, but many young people are still struggling quite significantly. So again, I emphasize safety within relationships. I've been seeing a lot more kids who are actually transgender now. So this has been really a new experience for me. I had met a couple along the way, but in the last few years, for some reason, I've seen many more, and these are young people who are really struggling with identifying themselves as a different gender as they appear biologically, and I experienced this in adolescence, but I also experienced this in my 5-year-old and 7-year-old who are also dealing with similar issues.